Hello, I'm Dr. Valerie Leva. I'm a clinical supervisor with Stan County BHRS. I also work in the training department, developing trainings such as these, the intern and new associate training series. Today, we're going to talk about an interesting topic. It is alternative treatments that do not include usually talking about trauma or medications. We're going to talk about something called neuromodulation, which is an umbrella term for transcranial magnetic stimulation, and biofeedback, which also includes neurofeedback. And we're also going to talk about EMDR and how to obtain trainings for these. I'm going to start the PowerPoint now so we can get going on it. Okay, since you're using this online, we don't have to talk about training room priorities. So I have to give some disclaimers in this one. I have provided a biofeedback called HeartMath, a neurofeedback called Neuroptimal, and I am an EMDR trained provider. So I just want to say I don't have any financial interests in any of these devices or the organizations I'm going to be reviewing, and I'm not making a recommendation to purchase from them. I just wanted to share my experience with them so that you can see if this is something you're interested in doing or interested in conveying to your consumer or your member, because there are many more options that have been developed in the past 15 years than just medication and talking therapy. So the learning objectives for today are to introduce you to biofeedback, neuromodulation, EMDR, and treatment for mental disorders, particularly for trauma. So we're going to have to talk about the brain a little bit. So first, what is neuromodulation? It's a series of techniques that act directly on your nervous system. So we're going to talk about different ways that we are working primarily with the brain and devices that are used around the head or devices that monitor your heartbeat so that we can help folks change those. And why would we change them? So the neuromodulation techniques we'll be reviewing are transcranial magnetic stimulation and neurofeedback. Actually, HeartMath is a biofeedback method that does not use the nervous system, but I put it in here because it's a very useful skill to know. I'm also going to talk about EMDR, eye movement desensitization and reprocessing. This focuses on working with traumatic memories and shifting neural pathways, but it's not neuromodulation. It's kind of its own thing. And we'll talk about that and how it works. Pros and cons. I just looking at the pros about neuromodulation EMDR. None of these require the client to take medication. Now, they do work best in combination with medication or with talking therapy, but they work really well on their own too. And we'll talk about this in terms of things like ADHD in children versus taking stimulants for ADHD. All of these are considered non-invasive. We're not putting anything into anybody. We're just measuring output and using that output to help the person shift. None of these require the client to verbally process anything, which is why this is a first for EMDR, particularly is a first line of defense, so to speak, in treating trauma, particularly people who are so triggered by their trauma narrative they can't process it verbally. And so neurofeedback is super helpful with that. So is EMDR. And there's very minimal side effects. And we'll talk in each method about what the side effects are. So we're going to start first with transcranial magnetic stimulation. And I need to correct myself. There is minimal invasiveness in these techniques. It's usually in transcranial magnetic stimulation. It's using magnets on the outside of the skull and the scalp to stimulate different parts of the brain. And so this one does have a little bit of feedback that gets to the consumer. So some of you might remember, I don't know, even in old movies, people getting electroconvulsive shock therapy. And that is a very invasive procedure. It puts an electrical current through your brain. So you have nodules on either side or that conduct the electricity across. And that has been used and actually is still used in some places for people with super severe depression who have tried multiple medications and talking therapy and get no remission. And they can't get out of bed. They're constantly suicidal, etc. So again, there are a lot of bad side effects to that. The big one of which is loss of memory, because it really affects the parts of the brain where we store memories. So I found a documentary, golly, about 10 years ago about a woman who was a psychiatrist, she's an MD and a PhD. I really like worship those people getting both those degrees. And she said there's got to be a better way to do this. And so this occurred at the same time we started having MRIs for the brain that were really refined. And uh, I can't think of the word for it, but essentially a CAT scan for the brain that were really refined. And so we were learning more and more about the brain, and we were able to map where different things happen in the brain. So we know about the HPA axis and how it produces cortisol in our body to make our fight or flight symptoms go sky high. We know where memory is stored. It's typically stored in a couple of places in the brain. We know the parts of the brain that affect speaking and affect singing. So we've mapped the brain pretty well. And so this is what's used in transcranial magnetic stimulation. I'm just going to call it TMS. So the stimulation is produced by generating a brief high intensity magnetic field by passing a brief electrical current through a magnetic coil. So again, this is outside your head. Um, and that magnetic field that's produced then excites or inhibits a small area of brain below the coil. Many parts of the brain can be influenced. The ones that are easier to influence are the parts just beneath the skull. Um, and when we think about the parts of the brain that regulate emotions, it includes the limbic system with all of these parts of the brain. So sometimes we talk about it about the reptilian brain being the brain stem, the older parts of our brain, older in terms of evolution that keep us breathing every day. And then we have the mammalian part of the brain, which we have some higher functioning. And then we have the cortex, which engages us in all of our decision making and higher order skills. So think about the brain in those parts. And if you're not familiar with it, I really recommend like the brain anatomy coloring book. It helps you learn the different parts of the brain. You can get lots of short videos on YouTube to learn about parts of the brain that are pretty accurate. So I've had consumers that I've worked with use this, and what they do is they've done their talking therapy with me, but they're really at an impasse. You have to try a couple of medications before you're qualified to do this kind of treatment. We'll talk about those later. But the consumer or the member is just, has really gone through all kinds of therapy, talking therapy, and providers that we can provide, and medications, and still isn't getting better. So these are the kind of folks that try transcranial magnetic stimulation, and it's more and more available. So we need to talk about rule outs, people for whom this is not appropriate for. So anybody that has a lot of metal in their body, particularly in their head. So people with magnetic implants, bullet fragments, aneurysm clips or coils in their head, stents, implanted stimulators. Some people do have stimulators implanted to stimulate a certain part of their brain, which includes implanted vagus nerve or deep brain stimulators. People that have pacemakers or medication pumps. And I think this also includes folks that are on chemotherapy pumps or have a diabetes insulin pumps, and people that have electrodes for monitoring brain activity. So TMS is suitable for pretty much anybody who's healthy, except folks that have these kind of implants. It's because they have metal in them. It does not include joint replacements like knee, shoulder, and hip replacements. So I want you to download and watch this video. It's also suitable to share with clients. It really goes over the whole process of what is TMS and what to expect. A couple of things about the side effects is sometimes people get headaches when they do this treatment, and the headaches do not persist long after treatments. It's also a pretty intensive treatment at the beginning. Now, the treatment only lasts 20 minutes, but you've got to most people go 5 days a week from 3 to 6 weeks for it to become effective. And then after that, you might come at 6-month intervals for a few sessions for tune-ups, so to speak. So it is a commitment. And we'll talk in a minute about insurance, but it is a commitment. But for people that don't have any other options for treating their depression, it's a lifesaver. So watch that video and then feel free to share it with clients after you've watched it. So what is it approved for? So this is FDA approved for treating depression, obsessive compulsive disorder, and anxiety. It is used off-label for treating PTSD and dementia. I think it's also recently FDA approved for migraines, or there's research into using it for migraines. So there are models that are being marketed for home use, but I've looked up the research behind these and they're not effective because they can't generate the level of magnetic field that needs to be developed by the device that's in the doctor's office. So this technique really needs to be provided by a trained technician. You will find these in doctor's office. It's usually a neurologist or a psychiatrist or both that go together and do this. And they have, doesn't even need to be somebody with a bachelor's degree. It could just be somebody who's trained on providing that particular treatment. If you're interested on the research behind the technology, use this link. It's really very interesting. This is not a necessarily a heavy duty research article. And you can always go to the end and read the results part or the discussion part, but it's really important if you want to understand more how it works. So Medi-Cal does cover this treatment. However, they have to have a lot of hoops to jump through. So they have to have a confirmed diagnosis of severe major depressive disorder, not moderate, not mild, severe. They need to have tried two different types of antidepressants and been resistant to treatment from these antidepressants, or have had severe side effects after using two different types of antidepressants. Other folks who qualify are folks who have a history of responding to TMS in previous episodes. Um, the client has attempted evidence-based practice talking therapy and was ineffective. And the order for TMS must be written by a psychiatrist who's examined the client and reviewed their record. So it can't be a nurse practitioner, it can't be us, it can't be somebody with a PhD or a psychologist. It has to be specifically a psychiatrist. Now, the problems with obtaining treatment is right now, and I don't know when you're viewing this video, but I looked this information up in April of 2025. Right now, there's only one provider in Modesto, and it's unclear if this provider accepts Medi-Cal. There are more and more organizations and practices that are popping up around the region, many, many more in San Francisco and the Bay Area, providing this type of treatment. Commercial insurance does cover this treatment under certain circumstances. It depends on the person's policy. And I know we work with Kaiser quite a bit, and I'm unclear if Kaiser provides this treatment. I haven't gotten emails back, or I haven't found the right person to ask. So it is really cutting edge technology. It is really very helpful to folks in these situations, and it's being used for more and more diagnoses. So keep it in mind. Think about it, particularly if you've got somebody with severe MDD that has not responded to medical or talking therapy treatment. So that's TMS. Now I need to talk about, sorry about that. Now need to talk about biofeedback, which also includes neurofeedback. So it's biofeedback for the brain. Heart math is biofeedback using your heart. But we have to talk about brain waves first for neurofeedback because that's really important for us to understand in order to understand how and why it works. So there are 5 types of brain waves. Delta waves, that nice deep sleep that so many of us desire but can't quite attain. These are the slowest waves, and we can measure our brain waves as electrical impulses, and this just runs at zero point 0.5 to 4 hertz. It's that super deep sleep. Some people can get it in meditation. Some people get it in transcendent experiences, but our brain has just gone, this is nice. So these slow waves. Theta waves are also sleep we experience during sleep. Um, and this can also happen when we're dreaming, when we're doing visualizations, when we're in a meditative trance. Again, these are slower waves, but a little bit faster than delta. Alpha waves is when we're kind of in the flow. We're meditative or we're creative or we're relaxing. We're in the flow of what we're doing, but we're not problem solving. So this is kind of either routine activities or meditative activities or creative activities. Might be while you're reading a book or sitting in the garden enjoying a beverage with a family member. So this is relaxation waves. And so they go a little bit faster than delta and theta, but it's really the sleep waves. Beta waves are the brain state that we're in when we are alert and concentrating and thinking and problem solving. I'm sure I'm in beta waves right now because I'm thinking about what's the next slide? How am I presenting this? Is the recording going well? What do I need to do if I get knocked off of Zoom because I record these on Zoom? So these are our problem solving, thinking, active, engaged brain waves. And then gamma waves go really, really fast compared to the others. And this is peak experiences. You feel synchronized with what you're doing, and you're really engaged in what you're doing. You get insights from what you're doing. And it can also be the ways people experience when they're highly agitated. They're totally triggered by their environment, by flashbacks or things are reminding them of this, or they're super upset. So they're not always the best ways to have gamma waves. It's good when they're good, and when it's bad, they're really, really bad. So let's talk about a moment for brainwave details. So again, gamma is the highest, increased use of memory and awareness, super focused on completing one activity. But people with PTSD have trouble shifting from gamma. They have trouble downshifting into alpha, theta, delta, or even beta for that matter. And the goal is to get folks in that situation to be more present in the moment. We call it grounding, right? And in an alert and beta state, just aware of their surroundings, alert, problem solving, doing okay, but not agitated and triggered. Beta waves, again, is when you're focused on work, problem solving, engaging in your daily activities. Alpha waves are the third highest. This is when we're resting and relaxing. And golly, isn't this a hard state to be in when we're triggered by our own thoughts? We're stressed out, right? We're overwhelmed emotionally by whatever. And just imagine folks who struggle with those states all day, every day. It's really hard to stay in an alpha state, even when you're trying to relax, but you're triggered by your feelings overwhelmed, the list of things you've got to do, your worries, etc. Theta waves, right? This is the wave that we're typically in when we're sleeping. Um, this is when the subconscious mind becomes accessible. This is when, maybe resting in bed, you're not quite awake. You sometimes have insights, or you remember things to do or that you should have done, or you think, oh, that's how I'm going to solve that problem today. So it's when you're daydreaming or just about to fall asleep. And people with ADHD struggle because they sit down in lower alpha and theta waves. And this is what it looks like. These are the brain waves that when we see them as distracted, these are the brain waves they're sitting in. And it's really a struggle for them to shift out of theta and into beta, the active, concentrating, problem solving mode. I only wanted to talk about those four because those four we typically uh, uh, struggle to experience delta waves, that super deep, deep, deep restorative sleep. So now we've talked about brain waves. Biofeedback is a technique that trains people to improve their health by controlling certain bodily processes that normally happen involuntarily, such as brain waves, heart rate, blood pressure, muscle tension, skin temperature. And this is from the Cleveland Clinic, which is a good resource for understanding how all this works. So during a biofeedback session, a healthcare provider uses a non-invasive monitoring equipment and instruments to measure your body's involuntary functions. So we're going to talk about heart rate and brain waves mostly today. So based on the feedback from the instruments, your provider is going to suggest how you can create voluntary conscious changes for these mostly involuntary functions. And a lot of it is stuff we tell people to do anyway, which is why we tell them to do it. Box breathing, long exhale breathing, 5, 4, 3, 2, 1 grounding, imagining a safer place. All these mindfulness techniques, even yoga, or imagining going on and listening to a guided imagery script. All of that, all those techniques will help people with biofeedback. And in this case, all those things are good to do with members, but here's how you measure it and help people realize I can change my body and I can downregulate my heart rate, my blood pressure, etc., just by doing these mindfulness things. Excuse me. So, HeartMath is a proprietary device and method of providing biofeedback to people that relies on the phenomena that's called cardiac coherence. So, cardiac coherence is an indicator of your heart rate variability. So those of you who have an Aura ring or do your smartwatch while you sleep, they can measure your heart rate variability, which is the measure of the time in between your heartbeats. So it's really hard to measure until the last 5 years, and we've got all these devices we can wear that tell us what our heart rate variability is. But here's why it's important. An abnormally low heart rate variability means there's very rigid heartbeats with no variability in it, is associated with deficits in attention and short-term memory, especially in combat veterans diagnosed with PTSD. And people with increased cardiac coherence or increased heart rate variability, it may lessen the severity of cognitive symptoms that often accompany PTSD, anxiety, panic disorder, and others. So why is HRV a big thing? Well, if your heart rate, if your HRV is highly variable, if your HRV is high, this is usually evidence that your body can adapt to changes. And people with higher HRV are usually less stressed and experience more feelings of happiness. In general, people with low HRV are those who might experience more current or future health problems because it indicates a body's less resilient to struggles and changes in circumstance. So again, this is one of those micro measures in our highly measured world these days that we can now measure for ourselves that indicates health, and overall general well-being. So this is how heart math works. And this is the website. And there's multiple videos on this website that show how it works. So what happens is the client connects to a heart rate sensor. So the heart rate sensor is clips to your earlobe and it measures your pulse through your earlobe. And then it has the transmission device people usually hook on their shirt. And then that transmits information to your smartphone. And so that's how you get your data. So nothing is being introduced to your body, no magnetic waves, no nothing. It's just measuring your heart rate and your heart rate variability. So the person connects to a heart rate sensor. They engage in the deep breathing exercises we all know how to do. They visualize or emotionally re-experience a positive or renewing feeling, something like calm space, appreciation, gratitude, an accomplishment of physical activity like petting the cat or the dog. And they continue to do this until they achieve their target heart rate coherence or heart rate variability. And the scoring algorithm continually monitors the most recent 64 seconds of the heart rhythm data and updates the score every 5 seconds. So you're sitting there looking at your phone and see it. And the more stable and regular the heart rhythm frequency, or the better the heart rate variability, the higher the coherence score. So if people with higher heart rate variability, which is good, get a higher coherence score. So that's how it works. And when folks engage in the mindfulness activity or the visualization, they can watch their score change to a better score. I know that when I am in a stressful situation, I use box breathing and long exhale breathing. I try to be inobtrusive because sometimes in public, and I actually will measure my pulse and I can feel my pulse rate go down. So it's not just the heart rate variability, the pulse will go down. So this is an interesting thing to do. It's an easy biofeedback technique to learn. It doesn't require a treatment provider. So this is not a medical device. It doesn't do anything to you. It's just measuring. So it's not FDA approved, but it's used to assist in the treatment of multiple conditions. Clients are advised to consult with a medical or mental health professional to see if it's appropriate for them. And it's not typically covered by insurance, but you can use your HSA, FSA money, those who are employed and have jobs and can put that money into their medical spending account. And the device costs from $200 to $350. Works in conjunction with a smartphone and typically is used at home or on your own. So when you do purchase a HeartMath device, you do get training videos on how to use it. And I have advised something like this to consumers and members. I've said, try it out, see if it works for you. Can you get a cheap device? Can you find someone that'll give you a demo? Do you like the videos? And clients with some means can usually afford $200 to $300. Our clients, not so much typically, but it is something folks can look into and maybe invest in if they think it will be helpful for them. So that's biofeedback. There are really no contraindications for biofeedback because, again, you're not introducing anything into the client body or psyche or anything. You're just measuring data and using mindfulness techniques, which are also very useful for clients and certainly are not usually harmful to clients, to help monitor and control that heart rate and the heart rate variability. So think about it. Explore it if you're interested. So I'm going to talk about neurofeedback now, which is a method of biofeedback that assists clients to control brain functions by measuring brain waves and providing some kind of feedback signal. So you're gonna look this up online, and you're gonna find a lot of older videos that show people wearing this like Frankenstein cap, this cap with all these leads out of it. That's not what's used anymore. That's not the cutting edge or the second generation anymore. I'll show you what's typically used. So you're using uh, a laptop usually now, just a laptop with some leads to it. You'll clip a lead to one of your earlobes as your ground, and then you're putting those little leads with the paste on it. You got to get it under your hair so it moves a little bit to your scalp on both sides of your head. That's to read your EEG, your electroencephalograph, and that's recorded. Not recorded, but that information is being taken in by the laptop and the software while you're in a neurofeedback session. And then its components are extracted, the feedback from your brainwaves, and fed to subjects, fed back to. I'm using the language from the corporation. The information is then fed back to the individual using an online video feedback loop and some type of audio, video, or combination. So let's talk about it, particularly the proprietary method that I have used, which is called NeurOptimal, which is second and third generation. So these are quotes from their website. During a neuroptimal session, you wear an ear clip and the two small sensors on the side of your head. They pick up the electrical activity of your brain waves. Are you in theta, alpha, beta, gamma, right? You relax and close your eyes and you listen to music, which is the one I use for adults, or you watch a movie, which is the one I've used with children. So what happens is NeurOptimal takes in that data from your brain, signals it's very rapidly, and then it detects them moving into an unstable phase. So your brain waves either are not in sync from one side of your brain to the other, or they're kind of between theta and beta, and they're not resolving into one of those brain waves. And what happens is you have earbuds in or headphones on while you're listening to the music. And what happens is there's just this tiny gap in the music, and our brains want to see something novel. They want to experience something new. And so when there's this tiny gap in the music, it just sounds like a click because it's a millisecond. Your brain kind of resets. You don't reset, but your brain resets. And it then brings those brain waves into sync with each other. Another version is watching a video. With children, I tend to use the more visual stuff. So watching a video, sometimes the screen darkens when their brain waves are out of sync, so it kind of fades. And then when they're looking at that and saying, "Oh, I need to concentrate," right? Because this is used a lot with kids with ADHD. The screen brightens again, and the sound goes back up. Sometimes there are software programs where the child is watching a video game and their car or plane, they have one of those to control, or a Pac-Man eating through the Pac-Man screen. Their car or plane wins the race when their brain waves are in sync. And so when they're watching their rocket fall behind, it's like, oh, I got to make my rocket go. And they focus on it. And that process of focusing brings their brain waves into sync. So the video that I put up here, it's on Facebook, so some of you might not be able to access it while you're at BHRS because of the block on social media. But watch this video. This is a video of a military veteran who experienced trauma. And this video is okay to share with clients, but tell them what they're going to see in it before you share it. This is a video of the veteran after he had done 3 sessions of neurofeedback. And you can tell he's scattered, he's not concentrating, he can't remember words, he's having poor word recall. And he's a little bit, he says he feels a little bit better, he's sleeping better, but he's not there yet. Then the second part of the video is 5 or 7 minutes long. The second part of the video shows him after having 10 sessions of neurofeedback and watching that video of him at the third session, he's going, oh my gosh. You can see he's engaged, he's making eye contact, he has more fluid speech, he's got word recall, he's doing much better. So how many sessions does it take? That's kind of standard to try somebody on 10 or 12 sessions and get their before and after scores. So let me talk about how you can access this, because there are providers in the Central Valley. Again, there are more providers in the Bay Area and Sacramento, but you can also access this online. It does not require any expertise to use. You can use it on your own, but you have to watch the videos about where and how to place the electrodes and how to use the software and what to expect. So this is now FDA approved for PTSD. It is not yet approved for ADHD, but the American Academy of Pediatrics states that neurofeedback is a level 1 best support for intervention for attention and hyperactivity behaviors. It's currently in studies to see if it can be used for stroke, dementia, and other neurological injuries and problems. And it can be used at the clinician's office, or you can rent units at home. So if you want to set up as a provider, and we could use some more providers, it's going to cost you about $15,000 for equipment and training as a provider setup. And I know a couple of people in the Central Valley that have done this. One was a teacher. She was a special ed teacher, and she's gone back to teaching full time, and so doesn't offer this as much. Another guy does this full time, and this is private practice. If you want to rent a unit for your personal use, you can't rent a unit and then go see clients with it. But it's only about $600 a month to rent a unit with unlimited sessions. And I do this once a year now for myself and for my family. I have a spouse with really bad ADHD. And it's astonishing how much better her concentration is, her ability to complete tasks, her ability to stay on task is she'll do a dozen or 20 sessions over the course of a month. The only thing that hasn't affected is her sense of time. She's not on time for anything. And I think that maybe is cultural as much as it is ADHD. And in terms of neurodivergence, I think she really has a very different concept of time than, say, I do. So it's going to affect a lot of symptoms. And there are plenty of measuring tools, just pencil and paper measurement tools you can use. And I do use those with everybody. And sometimes I'll ask folks to record themselves on their phone to see their before and afters. So this is a really interesting thing to use, and I can't begin to tell you how much it works. Bessel van der Kolk, the guy who wrote The Body Keeps the Score, talks about this a lot in his trainings. It is used a lot for people with PTSD. If I could buy one and just park it in every school in the county, I would, for every kid that's got ADHD or trauma. Um, if I could afford to just start up a practice and do this all day, I would, because I do it at reduced cost. Sessions cost anywhere from $30 to $50 a session to get it in the community. Most insurance does not yet pay for this. So it's got to be folks that have some resources. But again, if you're interested in it, here's a great article. It's a comprehensive review of all the designs and clinical applications. It's a really good article. And again, if it's something you're interested in, take a dive and see if it works for you. I need to take a break for a second and get a throat lozenge because I'm starting to lose my voice to talk about eye movement desensitization and reprocessing. Excuse me. So EMDR uses the brain's information processing system to naturally move the client towards mental health. This is an evidence-based practice for PTSD. And a great website to look at for yourself and to share with your clients is the EMDR link listed here. So some people say this doesn't make any sense. It just sounds like woohoo, what are you doing? Because this is where you run your fingers back and forth, or you tap on either side, or you have a light that goes back and forth for the person to follow with their eyes. But let's talk about how it works. Excuse me. Frances Shapiro developed this in the late 1990s, and she hypothesizes that EMDR therapy facilitates accessing the trauma memory network in the brain. So this is what she's conceptualized. It's not a thing you can see with a CAT scan, but it's the neural pathways that we talk about all the time. So with EMDR, information processing is enhanced. It gets both sides of your brain talking to each other by using that bilateral stimulation. And what happens in the session is the person is no longer in the traumatic event or location or with the smells or all the five senses of it. They're in your office. Hopefully they're in your office and you're not doing this out in the community, but they're in a safer place. And so new associations are forged between the traumatic memory and the more adaptive memories of I'm here, I'm now, I'm in the present moment. I'm not in the combat field. I'm not being assaulted. I'm not being abused. you use those grounding techniques to help the individual as they move through this process. This is not an explanation of how to do it. This is an explanation of how it works, because how to do it requires a lot of training. So these new associations or new neural pathways are thought to result in complete information processing. So you've completed processing that trauma memory and haven't gotten stuck with the memory because you can't tolerate the triggers or the flashbacks or the other symptoms. It also results in new learning. For many people, it results in the elimination of emotional distress and development of insights. I am strong. I have survived. I'm no longer in Iraq or in that hurricane or in that car accident. They can make these cognitive statements about themselves that they believe. And by believing that, they reinforce their neural pathways with this new learning. So how do you implement it? Well, you can complete an intake and provide psychoeducation about the process. And it might take a couple sessions to do. This isn't just session 1 and session 2. It takes a few sessions sometimes to do the intake. And you work with the consumer or the member to identify traumatic memories and events, and you rank them from worst to least worst. And then you do something called resource building to help the client develop coping skills specific to EMDR. So these just aren't the coping skills of mindfulness and grounding, but these are helping them engage in usually what I would call guided imagery to rehearse, right? So this is like imaginal rehearsing, to rehearse a situation in which they're successful in dealing with a traumatic memory. So you do a lot of that kind of stuff first before you start reprocessing the memory. So, for instance, I worked with a consumer at the VA who wanted to go be able to see games at the Oakland Coliseum. This is before they moved to Vegas. And if you were in that Coliseum, you knew there was a choke point getting in, and it is in most stadiums, where you're funneling in from the BART and the parking lot and the buses, and you have to go through this narrow space to get into the stadium. And it reminded him of choke points in Iraq when the forces that he was fighting would push people into a choke point where they would either ambush them or they would have a bomb there. And so he encountered many of those in Iraq, and it just freaked him out. And he wanted to go see Oakland Raiders games. And he also said, I want to go to arenas. I want to be able to go to concerts and those kinds of things. So that was his goal. So the resource building was just imagining himself not going through the choke point, but sitting in the Coliseum. Imagine that you're watching a movie where you're sitting in the Coliseum. Who's with you? What kind of seats do you have? What are you eating? What are you drinking? Imagine yourself being successful with that goal. So then once you've done that with the client, again, resourcing might take 3 or 4 sessions depending on the client's overall mental health. So step 2 is to have the client imagine the traumatic memory while engaging in the bilateral stimulation. And you break off repeatedly. Sometimes you slow up the bilateral stimulation, sometimes you speed it up. You ask them to rank, their bodily sensations, how much do they believe their cognitive, the flip of the cognitive message, like I am okay, I'm okay, those kinds of things. Get them to measure a number of places. Sometimes people will get in stuck places where they just can't get out of that memory. There's not enough neural pathways. They trigger bodily responses or unhelpful thoughts. And in that case, you go back to resource building and help them build more resources. And then there's other things called a feedback loop. And there's different techniques once you gain more expertise in EMDR to help the person with. So I have a brief video that explains the process. And again, this is okay to share with clients, but always look at it first before you share information with clients. Again, it's believed that EMDR works because the bilateral stimulation bypasses the area of the brain that got stuck due to the trauma and is preventing the left side of the brain from self-soothing the right side of the brain and vice versa. The bilateral stimulation, remember the brain wants new information. It's going to be distracted by something new. So the bilateral stimulation interrupts the stuckness and allows the brain's natural neural networks to reconnect from one side of the brain to the other or within each side. So this is a pretty simple process for single trauma, like fires, accidents, physical attacks. But it takes longer for folks whom we see at BHRS who have multiple or ongoing or complex trauma. But don't let that deter you. This is a really, really helpful method to learn. So when to use it? In addition to PTSD, it's also helpful for treating depression, anxiety, and OCD. It can be used with young children through older adults. It is covered by insurance. It's an evidence-based practice, but it must be provided by a trained clinician, and training is expensive. There's only a couple of contraindications, and that's for folks who are actively psychotic or intoxicated. And this can also be used where you have minimal. Let's say first, you're always working with a translator if you don't speak the language the client speaks. But once you've gone through all the resourcing and the upfront stuff you do, you're not saying a whole lot during the bilateral stimulation part. And so you might have enough language, your client might have enough language to communicate with you without the need of a translator. So must be provided by a trained clinician. So let's talk about training and where to get it. So I used an organization called EMDR HAP because I liked their mission and they were the cheapest. And I've recently looked at it and they're still the cheapest. Basic training requires 2 full weekends taken 3 to 6 months apart. And by 2 full weekends, I mean 3 days. Some organizations provide this as a 6-day training all the way through. EMDR HAP does it a little bit differently. It breaks it up. And I liked breaking it up because you have to get 5 hours of consultation, group or individual, after the first weekend, and then 5 additional hours after the second weekend before they'll approve you as saying, I'm EMDR trained. And consultation is similar to supervision, but it's not hours for you if you're licensed. They make that very clear. And you don't have to provide a certain number of hours of EMDR before you can do your consultations. I was in a couple of groups where some people just were not in an organization where they could provide it, or they didn't have the opportunity. You have to be an associate or a licensed person, or in your last year of your master's degree to get this training. And sometimes people would drop out of it. Well, they'd finish their internship and just wouldn't have any hours to do this with. But you can still do the consultation hours. And I did about half and half, group and individual consultation. And I did the individual consultation with somebody who was an expert on dissociative identity disorder. And you can use EMDR with people who have DID, but they have to be not moving between the different parts. So it's very tricky, and I wanted to learn those skills. So the training at EMDR HAP is $1,081. Consultation ranges from $50 to $100 an hour. I think I paid a total of $800 for my individual and group consultations. So it's expensive. Ask your coordinator if they'll pay for it. Sometimes they will and sometimes they won't. You never know when training money is available. If you have access to continuing ed money, if some of you are employed in other organizations and are doing an internship at BHRS, you might ask that organization to pay for it. It's well worth the money because I found it helpful for not getting so much secondary trauma of talking about trauma narratives. So by doing stuff like neurofeedback and EMDR, I wasn't listening to trauma stories all day. So it was very helpful for me at that point in my career, because I was working in a trauma clinic and everybody had trauma stories. And I know that's the case for many of you at BHRS. It was helpful to me, and for me, it was worth the investment to do it. Um, and once you are licensed, or maybe you're looking for a job, it gives you a leg up in hiring to say you're EMDR trained, because organizations know it's expensive to get the training. So that's it for today. It's a longer video than usual, but neuromodulation, biofeedback, transcranial magnetic stimulation, heart math, EMDR. All treatment protocols don't require talking about the trauma. All treatment protocols that don't require medication. And so it is an option for consumers or members who are struggling with those two, talking therapy and medication modalities. Right now, it's challenging to access it because of the finances, but you're just at the beginning of your career. Who knows what the landscape will look like in 5 or 10 years? So be ahead of the curve and learn about these so that you can offer them or talk to your clients about them as alternatives to treatment. So thank you for your attention. I hope this training has been useful to you, and I will see you in another training. Bye-bye.